As we all know, we are now into year 3 with COVID, and it has been a roller coaster ride that no one asked to get on. But through all of your efforts, we have reached a point where we can take another step towards getting back to life before the pandemic. While masks will no longer be required in most indoor locations beginning Monday, February 28th, I want to be clear that they are still highly recommended. There are places where, in fact, the mask is still required. The federal government still requires it in transportation, airplanes, trains, buses, subways. And masks are still required inside federal buildings in areas of substantial or high community transmission. Additionally, the Centers for Medicare and Medicaid Services continues to require visitors to long-term care facilities, such as nursing homes, to wear a mask when in the communal area of the facility. Masks offer a layer of protection, and for people who have an underlying condition or who are around people who do have that condition, or for those who are around children who are too young to be vaccinated, you absolutely may choose to continue wearing a mask. Similarly, if you find yourself in a crowded indoor setting, a mask will continue to help protect you. We will continue to recommend masks. As we move forward in a world where we will coexist with COVID, there are tools, there are masks that will help protect us and help prevent our healthcare system from being overwhelmed. Of course, we have an even stronger tool than the mask, and that's our vaccinations, including the boosters. And that is our very best tool for preventing severe illness, and we will continue to encourage people to stay up to date on their vaccines. We are still seeing, of all the people in the hospital with COVID, that 89% are unvaccinated. Another tool that we have include the therapeutics. We have oral antivirals, we have the monoclonal antibodies, and these medicines, which have come from the federal government, are absolutely in limited supplies, but people who test positive and are at severe risk of illness should talk with their healthcare provider as soon as possible about using these possible treatments. Our future, our new normal, if you will, is going to look different. And yes, we may see additional surges, there may still be additional variants, but there are still things that we can do to help reduce our risk. One example that we need to continue talking about is improving indoor air quality. Schools, workplaces, businesses, any indoor location should look at what upgrades can be made to their ventilation systems to reduce the infectious particles in the air. This might even apply to your home, where you can purchase maybe a portable air cleaner with a HEPA filter. Your actions that you've already taken have helped to reduce the amount of virus circulating, and it absolutely has saved lives. But be clear that COVID is not gone, and it won't be gone on February 28th. So we're going to continue to find ways to live with the virus. Our path forward includes keeping these tools that we've been talking about close, and that's the masks and the vaccines, testing, creating safer settings through better ventilation. We can do all these things, and we can coexist with COVID.